Okay, well, hello everybody. Good morning, good afternoon, and good evening to you all. And welcome to part 7 of our Exploring Ethics webinar series, and thank you for joining us. Just as a reminder, our series takes place every Wednesday on the same Zoom link, and generally this time, although next week it's at 7:30 p.m. Eastern Time. If you look in the chat session, you'll see our website and Facebook discussion forum links. I'll just put it in one more time, and I guess Sandy just put it in as well. We have some great webinars coming up in the next couple of weeks, and we'll just be delighted for you to join us. Keep in mind that though you will be muted during the presentation, we encourage you to use the chat function to ask questions, share your insights, and speak with others during the webinar. We'll be sure to reflect on all your comments and questions during the Q&A session at the end and unmute you at that time. Also, please note that we are recording for those who've either missed or would like to rewatch the series. And please rest assured your images will not be recorded. Only our speakers' videos and their presentations will be in the recording. Thank you all again very much for joining us. And now I'll have Professor Olivier Rubin introduce our speaker for today.
Thanks, David. So it's my great pleasure to introduce Andreas Reis, who is the co-lead of the Global Health Ethics team in the division of the chief scientists at the WHO in Geneva. And in addition to his extensive medical studies, he's actually pursued some social science courses and health economics and obtained a postgraduate degree in biomedical ethics. So his main area of work is actually public health ethics with a focus on ethics and infectious diseases. And he's lectured and organized numerous training for the WHO in more than 40 countries. He's published widely and is the co-editor of 3 books on bioethics and public health ethics. A recent publication caught my eye, where he argued in favor of applying AI more in decision-making processes surrounding the vaccine rollouts for COVID-19. Because humans alone are apparently simply not rational enough. And we actually wanted to hear him speak and pick his brain for more than 2 years now, but the pandemic always came between us. And that's why we're especially happy to be able to introduce Andreas in this series. Andreas, the floor is yours.
Thank you, Olivia, for this very kind introduction. And thank you also to the organizers, the organizing committee, for inviting me and WHO to this forum and for giving me a chance to reflect on our projects, on our work in the area of ethics and COVID over the last, well, almost 2.5 years now. And I'm really happy that we'll have a chance to discuss. I think this is also still a reasonably small group. So I really hope that we can have a great interactive session after I'm going through my slides. So I will try to share my screen now. Let me see whether that works. Yeah. Is it good?
It works, Andreas.
Yeah, okay. So here you see a brief overview of what I'm going to cover. So I will mainly speak about ethics and COVID and WHO's work in this area, but I would also like to start a bit earlier, because actually WHO has been doing quite a lot of work on ethics and epidemics and pandemics for the past decades. So, as I just said, WHO's work in the area of epidemics and infectious diseases goes back at least about 20 years, all the way back to the SARS outbreak, but also big issues have been equitable access to HIV drugs and antiretrovirals in the early 2000s, and then tuberculosis and ethical issues have been really a focus of our work. Vectorborne diseases, outbreaks and the related ethical issues to pandemic influenza, for example. All of these have really been major projects over the last 20 years. And in the following slides, I'll just highlight a few of these topics. So, as I mentioned, ethical issues that arise in the management of tuberculosis have been one of the major collaborations throughout the last probably at least 10 years, a very close collaboration with the WHO's global TB program. And a lot of work has gone into developing WHO guidance on all the ethical issues that arise in terms of access to treatment, in terms of screening, for example, migration, prisoners, special settings, children, and so forth. And this work obviously continues. Another area that has really been a major focus of work are the ethical issues that arise in vector-borne diseases. And here you see one of our latest guidance documents that was just published 1.5 years ago. And this talks about ethical issues that arise in vector control, in prevention and treatment of vector-borne diseases, such as malaria, dengue or Zika, research ethics issues, which arise, for example, in human challenge studies, and the new technologies, for example, gene-edited mosquitoes using the CRISPR-Cas9 methodology, for example, or Wolbachia and so forth. And finally, public and community engagement are very much key in this area of management of vector-borne diseases. Another document I want to briefly highlight is this guidance on the ethics of public health surveillance. And often surveillance is called the eye of public health. So what doesn't get measured doesn't count, some people also say. However, there are many ethical issues that arise in surveillance. Often there's a question whether surveillance activities are actually research or are public health activities. Do they have to undergo, therefore, the review of a research ethics committee? What about the obligation to have informed consent, to obtain informed consent from participants? Or what about the obligation to provide the standard of care to the subjects of public health surveillance and so forth? And of course, this area has gained a lot of prominence also during the COVID-19 pandemic. And the last document I want to mention before actually coming to the COVID-19 pandemic is the WHO guidance on ethical issues that arise in infectious disease outbreaks. And this document, which is a couple of years old, basically came out of our work on Ebola from 2014 and 16 and so forth. And it is really, at the time, we thought we had basically seen everything, and really brought together an excellent group of experts who developed this guidance, which summarizes really all the major ethical issues that arise in outbreaks. And I have to say, this was really quite a good basis to start off from when the COVID-19 pandemic came about, because basically, although there were some new aspects, many of the topics that arose, or the ethical issues that we had to confront, were actually quite similar to some of the others we had faced during pandemic influenza, or Lassa fever, or Ebola, for example. And I'm not going to go through all these, but I will discuss them later in the discussion on COVID. And just to say that at WHO, we don't only develop normative documents and guidance, although that is probably the most well-known function. But we also develop training tools based on these guidance documents so that we can train and support the countries. And we also have some online trainings, for example, on ethics and epidemics. And then finally, we also try to help as much as we can countries implement the guidance and use these tools. So in the past years, we've done quite a lot of trainings in ethics and Ebola. I myself went to Guinea 2 times to train the National Ethics Committee there, but also to other African countries for trainings on ethics of research during emergencies, public health surveillance, field epidemiology, and so forth. So quite a lot of efforts by WHO to basically bring the guidance that's developed at the global level down to the local level, and all that before COVID-19 actually started. Now, when the pandemic started, it became actually clear quite soon that ethical issues would be front and center. And here you see just a few quotes from our WHO Director General. For example, I'm not going to read everything, but he said, "I need to be blunt, the world is on the brink of a catastrophic moral failure. And the price of this failure will be paid with lives and livelihoods in the world's poorest country." Or, but we now face the real danger that even as vaccines bring hope to some, they become another brick in the wall of inequality between the world's haves and have-nots. So, and then he talks about solidarity, trust, injustices, and so forth. So a lot, and this is mostly in the context of access to vaccines, of course. So a lot of discussion about ethical issues from the start. And this is also why WHO already in February 2020 actually started with the establishment of a dedicated ethics in COVID-19 working group. And here you see the membership WHO working groups always by nature have to be regionally balanced. So we have 6 regions at WHO, and usually, sorry, somehow this keeps moving. Usually we also try to have a gender balance, and in ethics, very important, we try to have a very interdisciplinary committee. And this wasn't the only working group that was established. Actually, a bit later, there was a dedicated working group founded to analyze the ethical and governance issues that arise in the Act A. And then we had various subgroups on different topics, for example, on digital health, human challenge studies, immunity certificates, monitored emergency use of unregistered investigational interventions, but also public health and migration. And finally, it's really just a snapshot to give you an impression of how much work has been going on in this area. So we recently established sort of a consolidated working group at the beginning of this year on ethics and governance of COVID-19. And here you see the latest membership of this sort of umbrella group. And we're in the process of establishing new subgroups again on specific topics. Sorry, somehow this keeps moving. Yeah, so very busy time for us at WHO, and I have to admit that some of the other documents that I showed on vector-borne diseases, or also on artificial intelligence, which I haven't shown, were of course quite sort of slowed down by all these COVID activities that we were engaged in. So what were some of the content issues. What were some of the main ethical issues that WHO has been working on in the area of COVID-19? So one area, and you saw it in our green book, one area that's always very important in outbreaks and epidemics is the ethical questions of research for vaccines and therapeutics. A question that also has come up quite a bit is whether it's permissible to use unproven interventions outside research. There's always in epidemics, and it was the same in COVID-19, a lot of discussion about quarantine and isolation, restrictive measures and physical distancing, equitable access to scarce medical resources and priority setting is a major feature of epidemics, and this was no different in COVID-19. And then, as I told you, the area of public health surveillance has been very important, and especially highlighted by tracking apps and data protection issues. Mandatory vaccination continues to be quite a thorny issue. Of course, there are many more in terms of, for example, migrants or data sharing and so forth. In the following, I will go through some of these issues a bit more in detail. So the first issue that our ethics and COVID working group faced was research. And of course, in a situation like we faced in early 2020, where there were no therapeutics or vaccines available, there's an urgent need, and some people would even say an ethical obligation, to conduct research with human participants as quickly as possible. And of course, research with human subjects should always undergo ethics review. And this means that the ethics review committees that review these studies have to really speed up and do their best to rapidly review all these research proposals, which poses quite a lot of challenges. And this is why we published guidance and standard operating procedures for research ethics review committees, of how they should be going about the rapid review. The other very important area that came up in research is the ethical acceptability of human challenge studies. And as you know, human challenge studies are basically when you're infecting deliberately healthy volunteers with a virus or bacteria, and here with COVID-19. That, of course, is quite controversial. So as you saw, we established a dedicated sub-working group to develop WHO guidance on the key criteria for the ethical acceptability of these studies. Another very important issue that always comes up in these situations is whether placebo can be used in clinical trials in a situation where actually you could claim that there's no treatment available, and so there's no sort of standard of care, and some would argue that in this case the studies can actually be placebo controlled, but then you have a changing landscape, and very soon, as we all know, even within 1 year, we had the first vaccines. And so the question arises still today whether we could still undertake placebo-controlled trials, and that we addressed in a WHO guidance document as well. Another issue which I already mentioned that came up in a very major way during Ebola is whether one could use on an emergency basis unproven clinical interventions to try and cure someone or treat someone suffering from earlier Ebola or now COVID. And these uses of unproven interventions outside of clinical trials raise a number of ethical issues. And this is really our latest document. If we were still printing them, I would say fresh from the press, but I guess it's just a fresh link, which I don't have here, but I can put it into the chat later. Just published last month, and this enumerates a number of ethical issues that come up and provides guidance on informed consent, on the oversight mechanisms that should be in place. It also discusses the duty to monitor the results of these uses, even if it's outside of clinical trials, and also the duty to rapidly share the results with other providers and indeed the global community. Another big issue that has come up is whether COVID-19 vaccines should be made mandatory. And this has been discussed at least since the beginning of last year, mostly in healthcare workers and maybe senior citizens' homes. But there's also been some discussion, at least, of making COVID-19 vaccines mandatory in schools. And some countries have at least considered to make it mandatory in either the whole general population or in parts of the population, for example, for elderly people or some at-risk people. And WHO developed and published this guidance in April 2021. And we're actually just about to hit the button for an update on this document. What we are seeing is a trend in countries that mandatory vaccination of healthcare workers is quite widespread, but there's a tendency to not go into the direction of a general population mandate since the advent of Omicron. Another topic that I want to touch on is digital tools and COVID-19. And I think it's fair to say that COVID-19 has really revolutionized the application of digital tools in public health. Never before have we seen on such a scale the use of digital tools. And on this figure on the right, you see some of the technologies that have been used in the public health response to COVID. This has really taken off in a major way that we haven't seen in other epidemics and pandemics before. And one particularly controversial issue was the introduction of COVID tracking apps on the smartphones, especially if that is to be combined with face recognition, as some countries were considering or recommending. Another issue has been the fake news and the infodemics, really the epidemic of information and sometimes false information has even led to a creation of a dedicated WHO team on infodemiology or infodemics management and social listening. And this is an area which also raises quite a lot of ethical issues on which we are planning to issue guidance, and more on that later. And then finally, I talked about the importance of public health surveillance already. And what we're seeing is the introduction of AI-based tools in the area of public health surveillance now. And actually, WHO has just established a few months ago a new pandemic surveillance hub in Berlin, which will be using these modern technologies really on a big scale. Another big area, of course, for the world and for WHO and for our ethics work has been the area of priority setting and equitable allocation. So this was really one of our first policy briefs that the ethics working group published in early 2020, and it establishes a few key principles in the face of the shortage of respirators, therapeutics, diagnostics, and vaccines. Many countries had, of course, to deal with these issues of how to best allocate and who to prioritize for the allocation of these scarce resources. And I think that this has really been sort of the main theme on a global scale. Many ethical issues, but I would argue that this has been really the main challenge. And in a way, interestingly, that was also recognized very early on. This is why kovacs was already established in April 2020, which is one of the 3 pillars of the Access to COVID-19 Tools Accelerator, or ACT Accelerator. And this is a partnership coordinated by Gavi, the Vaccine Alliance, CEPI, and WHO. And the goal back then already was to facilitate equitable access to COVID-19 vaccines. So very early on, a realization that a special mechanism was going to be needed to promote equitable access to the vaccines. But as we see here, there was actually only limited success, or it took very long time to get this really going. So here you see our Secretary General of the UN, Mr. Guterres, who pointed out that, and this was, I think, about a year ago or 1.5 years ago, where basically the majority of the wealthier world was already vaccinated, while over 90% of the Africans were still waiting for their first dose. And he said, it's an obscenity. We passed the science test, meaning we developed the vaccines in record time, less than a year, but we're getting an F in ethics. And very in a similar vein, the WHO Director General was basically recommending to hold off on booster doses in the first world, while the third world now, entre guillemets, hadn't had their first dose actually. So there was a big debate, and this is last year in August, about whether it would be justified from an ethical standpoint to already do boosters when other countries haven't even had their first shots. The situation, fortunately, has changed quite a bit. So most countries by now have good access to vaccines. The problem is mostly one of human resources now and logistics of how to actually use the vaccines in countries, and there's still many associated issues. But the real question is, in the mid and long term, how can we avoid a new crisis like that in terms of inequalities? And this is why WHO and partners have established now a technology transfer hub in South Africa and other countries. And the aim is to have a local production of mRNA vaccines with a planned start of production by the end of this year. The midterm goal will be to produce mRNA vaccines also against other diseases, and the long-term goal, autonomy of Africa in vaccine production. And I'm pleased to say that our unit is engaged in strengthening the research ethics committees in some of these tech transfer hub countries. So as I mentioned, WHO has published a number, actually a great number of guidance documents and statements over the past 2 years in the area of COVID-19 and ethics. But that's in a way just the tip of the iceberg, because what has also happened is that there was a lot of request for advice and input from some of the technical departments of WHO, for example, on clinical management, on diagnostics and allocation, pregnant women, disability, aging, and so forth. And so there are many big and small ethics sections in different WHO documents. There have also been a great number of external publications, which the WHO ethics working groups facilitated or co-published. And I can't go through all of them, but they were also quite important in fostering the public debate and also promoting our guidance documents. There have also been quite a few outreach activities, multiple seminars organized through the Epidemic Ethics platform, which I can warmly recommend, but also collaboration with a lot of networks. For example, WHO has a very active network of collaborating centers for bioethics, which I'm managing. And there's also a global and regional summit of national ethics committees, which has been quite engaged in the discussions around ethics and COVID-19. Just to mention that we also have had our first WHO Pandemic Ethics and Policy Summit end of last year. And actually the recording is on YouTube now. So I'm also going to be happy to put the link in the chat. Some of the main topics that came out of this Pandemic Ethics Summit in terms of current and future ethical issues, you can see them here. So global solidarity and vaccine equity continues to be a main topic. We already discussed the issue of mandatory vaccination, new research designs, and adaptive trial designs, for example, demand new ethics oversight mechanisms. The COVID passes, vaccination certificates, is a continued debate whether we still need them or will again need them in the winter maybe. I already talked about the quite difficult issues that arise by the fake news and the infodemics and the erosion of public trust that is engendered by this phenomenon. There are many issues still regarding data sharing and also sample sharing. And then a lot of reflection has gone into the question of how ethics can be better and more effectively embedded in the decision making. And finally, we're already starting to draw a few lessons for future pandemics and for future preparedness. With this, I will come to a few reflections in terms of conclusions and the outlook. So first of all, I think it's clear that epidemics and pandemics will keep emerging. In the global village that we're living in, there's certainly a tendency for the infectious diseases to spread more and more rapidly. what we've seen over the past decades is that zoonoses are often the cause. And this is why the concept of One Health is really very important. What we've also seen is that pandemics obviously know no borders. This is why international cooperation and global solidarity are really essential. And this is also why WHO's member states in December decided to establish an international negotiating body, intergovernmental negotiating body, to draft and negotiate a WHO convention on pandemic prevention, preparedness, and response. And the first meeting already took place, and the second one will be in June next month. Also, a few thoughts on how important health ethics is in epidemics and pandemics. I think what we have seen is that it's really necessary to strengthen the infrastructure and the discipline health ethics in terms of the clinical ethics committees, the research ethics committees, but also the national ethics committees, who have been really instrumental in many countries in guiding the governments on the thorny ethical issues that have arisen. And in our view, ethics needs to be an integral component of pandemic preparedness, just as laboratory and surveillance, for example. Ethics should really be integrated in the preparedness efforts of countries. And finally, we also have clearly seen the need for strengthened international collaboration in the field of health ethics. And with that, I thank you very much for your attention.
Thank you so much, Andreas, for this fascinating insight into the machine room of WHO ethics. There's so much to talk about and discuss, but I'll open the floor first. I have some questions, but I'll see if there are some questions from the floor. Remember, I mean, you can post the questions. We'll unmute you, or you can type it in the chat. If there are no questions, I can't see. David, do you see any questions, or Sandy? Then I'll. Oh, David has a question, maybe. Yeah.
So first of all, I'd like to thank you for that very interesting presentation. I actually had no idea how much the UWO is doing, or WHO. One question I have, let's say 5 years from now, we're faced with a new and different pandemic spreading across the world. From an ethical perspective, do you think we would do better?
Thank you, David. That's an excellent question. As I said, when we developed the 2016 Green Book, after summarizing the experience of SARS, pandemic influenza, Ebola, Lassa, MERS, we thought we sort of knew it all. We were well prepared. I do think that probably the ethical framework was pretty much there. But the thing is that every pandemic, and certainly this one, has very specific aspects that raise very specific ethical questions. So I think there's only so much you can do to prepare. And the other issue is that I think maybe that, or certainly there needs to be more emphasis on implementation in countries. It's not enough to only have a global guidance there, which I think was quite complete actually, but maybe we haven't done enough working with countries to actually bring that to the country level. So I would think that we would be even better prepared next time around, but it's very hard to be completely prepared for something new that comes up. Over.
Thanks. And now the chat is light with questions, so I'll just read the first one in case you can't see the chat. First, some praise, wonderful, comprehensive presentation. And then the question, is there any measurement of uptake of WHO ethical frameworks? Do these get published? I know you showed some, publications or outlets from the working groups and so on, but what about from the WHO itself?
Yeah, it's an excellent question. This is what we actually, are worried about as well. Is the uptake, and I mean, we of course have statistics of download and so forth, most documents are in the tens of thousands of downloads. Some are over 100,000, but not in the millions. And of course, the question is also who reads the documents. I think what's really key, and that's unfortunately a bit hard to measure, is the uptake by ministries of health, for example, and key stakeholders, policymakers. And there, it's really not easy to estimate the direct impact. In addition, as you know, WHO doesn't have any, how to say, legal enforcement. The only organization with in the UN with legal enforcement powers is the UN Security Council, who can actually send troops. But luckily, WHO doesn't have that kind of function. So it's really a purely soft law and really an appeal to countries to work together and to all the stakeholders to respect ethics.
Thanks. And then there's another question in the chat. That we locked out in this COVID-19 pandemic in terms of mild virulence and relatively low transmission rates and so on. But what happens if the next pandemic or epidemic is not as mild? I mean, of course, it's not mild when you have millions of people killed or fatalities, but yeah. Well, what if Ebola just with higher transmissions?
Yeah, excellent question. And I would agree. And it wasn't completely mild as the pandemic influenza in 2009, but still, compared to Ebola, for example, with over 50% mortality, it was still comparatively mild. And I would say, based on my experience with Ebola, I think the reaction could be, quite more drastic in terms of very severe lockdowns and also potentially big conflicts about the resources, that then become really a matter of life and death. So that, is a pretty terrible scenario. Which we really don't hope that it will arise.
No, I don't think you have to be in the WHO to hope that doesn't arise. So I have a question that pertains more to sort of the ethical, you could say, discipline or paradigm, because I mean, I guess ethics is not sort of, it doesn't create a unique result. There's not only one solution to ethical issues. And how does the WHO position itself in that? I mean, you mentioned, for instance, placebo studies. I mean, where you get so, and there it's clear that either you're allowed to do it with some guidance of how to do it, or you're not allowed to. But you can take both positions. I mean, in sort of ethical and be most of us strive to be ethical people and behave ethically. But you can argue both, sides of the coin. So how do you balance, and what kind of ethical compass does the WHO follow in these situations? And how do you decide on that? Because sometimes it's not enough just to raise that there are ethical issues, but how do you then balance out the ethical sort of dilemma? Yeah.
So fantastic question, Olivier. That really puts the finger into a very difficult spot. And there are different aspects to the answer. So for one, WHO as an international organization always has to strive for a consensus. And so, as you say, there are often different options that of proceeding that would all be considered within sort of the ethical framework. And so often the WHO documents are not very prescriptive, also because of the soft power. So we will not say countries must do this and that, but it will be sort of ethical considerations, or here are some ethical options of proceeding, and here are some clearly unethical options, or options that are against human rights, for example, discrimination and so forth. But we would mostly suggest a few courses of action to countries that they should consider. How do we arrive at this consensus? That is also a very tricky question, because obviously we have a global committee with many different schools of thought, many different cultural traditions also. And I can tell you that it's often not so easy to really bring everyone to a consensus. Also, you have to remember that we're not doing, in a way, ethics, in the abstract, but it's always ethics of a technical issue, so ethics of cancer screening, ethics of tuberculosis, ethics of COVID-19 research or something. That also means that we always work with technical experts, which is different. If you work on, I don't know, COVID-19 laboratory, then you get a meeting of laboratory experts. But we would always have to marry sort of the ethics and philosophy world with the technical world. And so this also requires quite some, understanding, mutual understanding of the different groups. So it is sometimes quite challenging, but I would argue that it's still quite helpful for countries, especially that countries that don't have the resources to do sort of a similar process, to have already a document which lists very well the arguments pro and con, and so that they can take it into account in their policy making.
Oh, it makes sense. Thanks. So just to follow up, so these guidelines for placebo and so on, they're not taking a stance whether it's okay or not. They're just listing, and not just, but they're listing the benefits and ethical drawbacks of doing these kinds of things. And so countries can make their own decisions, individual decisions. Yeah. So the WHO does not have a position on these issues.
Yes, I mean, okay. The placebo issue is particularly difficult because it also depends on the local availability of standards of care. So it really depends on the situation. But these situations are quite well described in the document that we produced. Yeah.
Okay. Yeah. Thanks. There's another question about business. Does the WHO have an ethical focus on the business sector in healthcare, meaning sort of big pharma and so on, and what are the implications of that in the management, in healthcare in general, and the management of the pandemics, I guess, in particular?
Yeah, equally very important question, the role of industry, and it is quite a complicated role with WHO, because as you know, there's always the importance of managing conflicts of interest, and so this has to do with the selection of experts for the expert groups, where WHO is extremely careful to manage the conflicts of interest of the experts well. And sometimes this will also lead to the exclusion of experts, because they all have to fill in pages long of potential interests in terms of stocks, in terms of contracts with pharma companies or lab companies and so forth. And if there's a potential conflict of interest detected, this can lead to the exclusion, or also to an observer status only. So on the one hand, it's very important to include big pharma or companies. At the same time, in order to give independent advice, WHO takes a lot of care to keep the commercial interests at arm's length. and to be very transparent about potential conflicts of interest. Because in the past, there have been many accusations, and it is a very difficult area. If you think about, I don't know, a very senior, let's say, 60-year-old expert, to find someone who's really world-renowned, has never had any contact with pharma, for example, is basically impossible. So you have to manage that, history of collaboration with the companies. And by the way, it's even more difficult in my experience in the area of artificial intelligence and digital health, where the big tech companies really are key players. There's no way to develop any guidance without them. At the same time, there are very big commercial interests. And it's very hard to deal with that, tension. Over.
Thanks. Michelle asks, any way we can make N95s more affordable for wider release before the next pandemic?
Wow, that's a difficult question. I must say I'm maybe not the expert for this. Probably there should also be more local production stimulated, I would assume, but I would have to pass on that question.
Okay. Then I have one. So you mentioned that the WHO has had focus on ethics for 20 years at least in terms of pandemics but internally, I mean, do you think that COVID-19 has pushed the ethical agenda both internally in WHO and other international organizations more, or has it helped, these sort of ethical committees and so on? Is there more funding now internally? Is there more attention? Has COVID-19 paved the way for ethics or these behavioral ethical consideration in public health?
Yeah, also excellent question. So yeah, I'm just coming back from the European Summit of National Ethics Committees, where we also discussed similar questions. And I think the sort of consensus there is that for sure COVID-19 has made the ethical issues more prominent also for the lay public. So the national ethics committees, also our unit WHO, has been in very high demand, and in many countries, the heads of the national ethics committees, for example, have been going from talk show to talk show every evening, have been included in the task force of the prime minister or of the parliament. So a lot more sort of recognition and demand. At the same time, not many committees, and I would also include WHO's unit, have seen increase in funding so far. So we're hoping that this would sort of follow later, but yeah, so far not that all the ethics units and committees are now rich, but we're still hopeful.
Sorry to hear that. Dave, you had a question as well?
Yeah, I'm just wondering if I could pick up on a comment you made, Olivier, about ethical dilemmas. So you had the UN Secretary General saying that the world got an F in ethics. So I have maybe a 2 or even a 3-part question. One is, I wonder if you agree with him, would you give the world an F? I can think of some like real ethical failures. For example, when some politicians cynically use this as a, to help their own personal political career or defeat into culture wars or something, instead of, doing their duty to the public like they should. But at the same time, there are so many ethical dilemmas where there's not one right answer or wrong answer, but just different perspectives and values. So I suspect he's speaking from maybe a utilitarian perspective. But any one country owes a primary duty to their own citizens above the citizens of other countries. And this whole notion of what degree should we help others before we help ourselves is a fundamental ethical dilemma. And many of the problems are these fundamental ethical dilemmas, which are not going to go away. They will always be there in every pandemic and will create barriers and difficulties. So would you give the world an F as well? And to what degree do you think these ethical dilemmas, and there are many of them I think that we're facing, are just always going to be barriers to us succeeding the way we would want to in these kinds of events?
Yeah, great question and observation. So yeah, I think the Secretary General, of course, has to use drastic words. So I'm not sure I would actually give an F, but in the situation where he said that, the situation was really quite bad still, at that time where the first world was discussing the third shot, and the third world hadn't even gotten the first shot, as somebody put it. That was really, unbearable situation. But as you also rightly said, the elected officials in the rich countries, of course, have their first duty is to care for the national population. So it's, in a way, it's understandable that they see to this before thinking of other countries. At the same time, I think I'm hopeful that in the pandemic treaty that is now being negotiated, there could be mechanisms could be found. For example, local production, autonomy in terms of the regions, that we're not again next time in a situation where we will have this, very inequitable distribution. And it's difficult, and these negotiations will take a couple of years. But I hope that global community will be able to find innovative mechanisms to prevent such a situation in the future.
So from a moral or ethical point of view, if you were faced with freedom convoys and widespread demonstrations against public health measures like masking and so forth, or vaccination, and if you were Prime Minister of Canada, say, what would you do from an ethical perspective? And I know I'm putting you on the spot here, but I'm curious what you might say.
It is a very difficult question. So I think, first of all, there needs to be a lot more efforts in terms of communicating well with the public. And I think some countries have done a better job than others, but for sure, risk communication has become really an art. And there needs to be dedicated people who know how to really, understand the public and also communicate well the public health necessity of some of these measures. At the same time, it's tough, as we are saying, as I was saying, with the infodemics, all the fake news, and social media. It's very difficult to really, keep a handle on these situations. So, yeah, I don't think there's any magic bullet, but yeah, can't emphasize enough the importance of communication and trust in the population in these public health measures.
That's a good way to end. But we do have, if I can borrow your time for 2 minutes, just an important one, I think, with regards to, the future emergency management and disaster structures and so on. How can we how can we inject ethical thinking into these sort of first responders and nurses and so on in sort of educational? Does the WHO look at that, or do you have any personal views? Or
yeah, I would say that it's very important to include modules on ethics in any courses for disasters and emergencies. And I'm just looking at, we have an online training course. I'm just mindful of the time, but I wonder whether I can find it. Yes, I have it here. So this is one resource that you can use, but there are certainly also others. that people could look at and then take online.
Great.
Yeah.
And there were also some other links you promised us, but if you just email them, we can upload them to YouTube together with the presentation, and then people can access the links as well. I forgot all the links. There were several you promised us. Thank you so much, Andreas. This was really, really interesting and insightful. And we really appreciate you coming on here in this webinar. There's another link. Do you cover them, Sandy? Or okay. And there's even one. Michelle says she has already taken these 3 courses. Very helpful. So that's another feather in your hat. Thank you so much, David. Do you want to say something about or Sandy, the next speaker next week?
Thank you so much for everybody's participation today. And remember that next week it starts at 7:30 Eastern time. We have Dr. Zeb. I'm missing the last name right now.
Jem Rosing.
Thank you.
Jem Rosing, yeah. We have worked with him as well. He's great.
He'll be speaking and sharing with us. So look forward to everybody being here.
Thank you so much.
Thanks, everyone.
Bye.
Thank
you so much.
Thank you for your time. Wonderful.
Bye.